Hi, welcome back to True's Autism Triumphs. Today my name is Alma. Would you please tell me a little bit about your expertise in autism?
Well, I've been in the business, I guess you could say, for over 40 years. I started at Devereaux, working in the residential treatment units with little ones as young as 4, and then up to adults. And then from there, I went to child study clinic, where we did a genetics clinic, and so we saw, autism, not only just autism, but the genetics and everything that came about. So I went there, and then I went to Coach Bend here in Victoria, and then we moved to Hallettsville, so I moved to Blue Bonnet Trails, and then up there, and then back to Coach Bend, and so I've been at Coach Bend over 27 years.
So to get started, I wanted to ask you, what is the best route for a caregiver to take for the most comprehensive care of somebody with autism or IDD?
I strongly recommend that the parents or the caregivers get a medical diagnosis of the autism. A lot of your school districts do the autism first aid testing, but a lot of agencies, Social Security, and ourselves do not accept the diagnosis from schools or psychologists or even psychiatrists. So we're needing a medical diagnosis. So we have Driscoll that has an autism center, Texas Children's Hospital in Houston has an autism center also in San Antonio. Yeah, they do the neurological studies and work that stuff out. So you can get your medical diagnosis.
Could you share how denial can hinder success with a individual who has autism?
I know it's hard sometimes for the parents hear the first words of autism, and they don't want to believe their children. Of course, I just tell you that's wrong. But a lot of programs that they're going to need as they get older require that they be placed on what we call an interest list. It's a fancy state word for waiting list. And it takes years to get off these lists, up to anywhere from 15 years, and depending who's in the house. And so when we have, it tends to be when there's Republicans in the House, not too many numbers are released. So, like I believe this fiscal year, we're only going to have 2 HCS slots released. It takes a long time. And so putting that denial there hinders, your loved ones to be put on this list. So as they grow older and you get older, they're going to need, you're going to need assistance to care for them at home or outside the home. And so while you're pondering what to do, they're falling behind in these programs to come up to them. So yeah, I know it's difficult. It's a lot of information right away, especially everything being brand new. But go out, talk to other parents, seek out information, do some work, do some studies on the internet, whatever you can find information-wise to get yourself educated, to make sure you're doing what's right for your child.
Um, Another thing is, what are some options for caregivers of working no longer with
There are several opportunities available. Medicaid has some CFC programs that are available where you can hire a provider to come into your home and assist with them at home with provider care and other programs through the CFC program, which is a Medicaid program. We don't have any doesn't have anything to do with those, but you can get that through your Medicaid programs. Just calling the back of your Medicaid card. There's an 800 number. Let them know what you're looking for, and they'll direct you to where you need to go. If you come into our program, of course, we put you on the interest list for ACS, it's going away, and those programs, within the programs, have services where you can hire people to work again with them at home. You can become what they call a host home provider, or one of your family members can be a host home, where that individual can be getting paid to care for that person. We also have group homes, which are smaller group homes. There's usually, if it's a three-bedroom, it's only three people. If it's four bedrooms, it's only four people. So, there's a lot of services within those programs. You also have your ICF homes, which are technically larger group homes. And those, there's never waiting lists for those. It just depends on what's available in the area. Here in Victoria, there's only two ICF homes with now female, and those openings are rare and extreme. So you can just be looking for out of town replacement. But those homes are larger, so if there's a three-bedroom, we usually have like six individuals. They don't get their own room unless the house is, kind of designed differently than you want to have somebody that has their own room. So yes, there are a lot of, but again, educate yourself, ask questions. Don't sit back and wait for something to fall in your lap because it's not going to.
Another question is, what if somebody doesn't know? I mean, I'm so sorry. Yes. What if someone doesn't know where to get help? Where do you recommend? Like, are there certain websites or places?
There's always websites. I mean, you can type in autism, and there's a slew of things that come up. The school districts have your good school districts. There's one in school districts. So hopefully you get a good school district or somebody that's really informed in the schools. They can point you to the right direction. You can always call 211 for information. They are a slew of resources for everybody. Of course, phone in. I get phone calls every day if I have no questions about who would qualify, how do we do this, how do we do that, where do I go, things like that. So, yeah, again, you have to dig them out, but, I would start with your school district definitely, and then, go into your community services.
Another question is for the parents who just feel like they're really old and maybe just feel a little out of place. Like, what do you have to say to them?
It's very difficult. I have a grandchild that's also autistic, and he's 10 years old now. We thank God every day he doesn't have a behavioral issue. He is nonverbal, so he does use his communication device pretty well. He does speak occasionally, so I know sometimes it can be embarrassing to go to the store and they fit looking at you or staring at you. And it's like, those kind of things, unfortunately, you don't have any control over. They're going to happen. People are going to be judgmental. People are going to be like, just put it out there. They can be ugly. So not knowing what's going on, what the issues are, you're going to get the looks, you're going to get the stare. And that's so problem. You have your child, you got to take them out in the community. You got to get them, used to surroundings and all that. And if other people don't like it, oh, well, that's their problem. But, just don't be concerned about how other people are looking at you, feeling about you, because they don't know your everyday struggles. Only you do, and of course your child. So you try the best for them. Treat them like you would any other child. Discipline them. Have structure for them. Let them be self-reliant. Be independent and all that. Just because they have a disability does not mean they can't do anything for themselves. And it's hard sometimes. It's easier if I just do it because it takes them forever to do it. Get up a little earlier, maybe, do things with them. Being a sibling of a child like that. It's frustrating. It's like, every day it's the same struggle, and every day it's the same thing. But unfortunately, I love to say it gets easier, but it doesn't. It doesn't get easier. It's just because part of your life. And you just learn in your family, because everybody's family is different. Every autism is different. So, you just kind of have to see what works for you, what structure works for you, what might work for somebody else. What you read, it sounds wonderful, may work for them, but it's not going to work in your home because your child may be nonverbal, he may not walk, he may not, he may have extreme behavior issues. There's no medication is going to cure. I can guarantee you that. It might be a little bit improvement, but you're never going to see a cure-all on any kind of medication. So it's like, just open your heart, and hopefully, you have support within your family they can also provide that support and that grooming that doing your best and your child is who he is. We all have children, so-called normal children. Some of them are pains in the butts, and they stay pains in the butts. And, you have to learn how to deal with them. Same thing here. So it's like, just whatever works for your family, whatever makes you happy and the child is happy. You know, it's everybody else.